I think a lot of people are made to feel embarrassed or have this feeling of, oh, I can't be available to my husband in the way that I think I'm supposed to be. When in reality, your pelvic floor has literally run 2 marathons. If we're talking about the amount of stress on the pelvic floor, we shouldn't expect that our pelvic floor can bounce back within a 6 week time period. It's actually just not realistic at all.
You're listening to the What the Gut podcast, where busy moms can come for a holistic approach to health and vitality. I'm Allison, your host, a holistic health and wellness coach. In this space, we'll dive into the intricacies of achieving holistic wellness while balancing the demands of daily life as a busy mom. What the Gut is your haven for navigating the challenges that come with juggling numerous tasks while aiming for a healthier, more balanced life. Join me as we uncover practical solutions to common health hurdles, from managing fatigue to understanding all things gut health. Through insightful discussions, actionable insights, and tailored lifestyle strategies, my goal here is to empower you to embrace a vibrant, nourishing life while saying goodbye to being overwhelmed and exhausted. So if you're ready to embark on this transformative journey towards holistic well-being, hit that subscribe button. Get ready to discover the secrets to thriving in motherhood while nurturing your overall wellness. A quick reminder, everything discussed here is for educational and empowering purposes only and is not intended for personalized medical advice. Consult your personal healthcare provider for personalized medical advice. Welcome to What the Gut, where we create our own path to holistic health, one episode at a time. Today on the podcast, we have got Molly Bachmann, and Molly has been a guest on the podcast before, and I'm so excited to have you back. Molly, how are you?
Good. Thank you so much for having me back again.
Yes, I loved our conversation last time, and I'm excited to dive into another fun topic today. So many moms postpartum deal with so many struggles, right? There's so many things postpartum. But one thing that I really want to talk to you about today and get your advice on is painful sex postpartum. So, Molly, I'm going to kind of open it up to you now. I have so many questions and don't know where to start, but
Huh.
please tell me why that is such a big thing that moms struggle with and what we can do about it.
Yeah. So I definitely want to start off by saying painful sex postpartum is very, very, very common. I see a lot of patients postpartum for this condition. Many of them come into my office thinking that they're the only one, that they must have this complicated condition. Nobody seems to know what's going on, that kind of mentality. And it can cause a lot of emotional and psychological distress and relationship distress as well. So I definitely want to emphasize that this is actually a really common thing postpartum, and there are a number of reasons why sex can be painful.
Let me ask you, Molly, whenever you first see these patients come to you postpartum, how far postpartum are they? Like, how far out from having their baby are they? How soon do they come see you?
Yeah, so technically, I cannot do any sort of internal examination of the pelvic floor until they've been cleared by either their midwife or obstetrician. And so usually that means the earliest I'm seeing somebody for a pelvic floor condition is about 6 weeks. I actually would really prefer to see them sooner because there's a lot we can do externally, but most of the time, it's about 6 weeks, and then sometimes people don't tell their doctors that they're dealing with these issues, or maybe their doctor says, "Oh, that will just go away with time." Lo and behold, it doesn't, and so a year or 2 years or sometimes 5 or 6 years later, I'm seeing them for the first time.
Gotcha. Yeah, that was something I was wondering because I'm sure a lot of people don't tell their doctor right at first because they too might think that this will just kind of go away. It might be expected
Right.
and think that it's normal, but that's it's good to know that some people are voicing their opinions and telling their doctors that, "Hey, like, is this normal? I'm not sure."
Right.
And that they're seeing you sooner.
Yeah. Well, and I think a lot of people too are made to feel embarrassed or ashamed or have this feeling of, oh, I can't be available to my partner or to my husband in the way that I think I'm supposed to be. When in reality, your pelvic floor has literally run 2 marathons if we're talking about metabolic load and the amount of stress on the pelvic floor. If we expected the same thing of our quadricep muscle the day after a marathon, it would be impossible to go upstairs and do several squats and do all these things. We shouldn't expect that our pelvic floor can, quote unquote, bounce back within a 6-week time period. It's actually just not realistic at all.
So, what are those you mentioned that prior to the 6 to 8 weeks, once a female gets cleared from their doctor to possibly go and see a pelvic floor therapist, that there are some exercises and things they can be doing to strengthen the pelvic floor right in that immediate postpartum time. I would love to know what some of those things are.
Yeah. So, in those first kind of 6 weeks of healing, we need to think about how the birth went. That's a really important consideration. So, if you're somebody who maybe had a lot of medical intervention, like a vacuum or a forceps or an episiotomy, those kinds of medical interventions, that is going to increase the amount of physical trauma that was made to those muscles as opposed to a spontaneous vaginal birth without any sort of additional medical intervention. Even same thing for a cesarean. There should be some nuance and difference depending on how the birth goes. I do want to put that out there. If everything is nice and tidy and worked out in a quote unquote perfect way, those first 2 weeks, you're really resting and allowing yourself to be cared for by your family and your friends and maybe your postpartum doula or whoever is a part of your team. So we say in the bed for those first 2 weeks. Those next week and a half, 2 weeks, depending on how you're recovering, we say on the bed, meaning you're theoretically cleared for some lighter activity like maybe a bridge or some straight leg raises. Think of really gentle mat exercises. And then those following 2 weeks after, we say next to the bed. So that would be generally an appropriate time to try things like a mini squat or some heel raises or some of these things where you're upright and working against gravity. For somebody who has experienced a larger degree of pelvic floor muscle trauma, think, your grade 2, 3, and 4 tears to the perineum. Think any sort of additional medical intervention like the forceps or the vacuum. A lot of those interventions tend to be correlated with the onset of really tight pelvic floor muscles afterwards because that muscle is reacting to a painful stimulus. And so a lot of people have this belief that we should be doing Kegels or pelvic floor contractions in those first couple weeks. But if we know that it's more likely that you actually have tight pelvic floor muscles because of those interventions, our rehab should actually look really different in those first couple weeks. It should be more, how can we improve the scar tissue? How can we reduce that muscle tone to improve blood flow and nutrition to the area? How can we reduce pain or any sort of unwanted side effect because of that? And then once those muscles are in a healthier, better place, then we can start with the contractions in, the spectrum that we do them.
So it's not so much if you've had more intervention, like episiotomy, vacuum, forceps, it's not so much that you're not as aggressive with healing, but you just focus differently.
Correct. It's a different starting point.
Okay.
As
Okay.
opposed to maybe somebody who had a spontaneous vaginal birth. We know that the pelvic floor muscles in a vaginal birth are stretched 3 times their normal length. So think of
Perfect.
yeah, perfect, right? About your bicep muscle, if I stretched it 3 times its normal length, it's totally reasonable that afterwards it's gonna have a harder time contracting and shortening that muscle because it's been so overstretched. Think of an overstretched rubber band, right? It's really hard to get enough elasticity to hold everything in place. So for those people, it may be appropriate to do some degree of pelvic floor contractions. We always want to consider how we're doing them, how long we're doing them, not just do 3 sets of Kegels. We really should be making it specific to the individual. So, for example, I've seen people who have really great pelvic floor muscle strength. They've got a lot of power that they can generate. But when I ask them to sustain a contraction and hold it for 10 seconds or more, they're unable to, which tells me that the endurance fibers of the pelvic floor are not where they're supposed to be. In comparison, you may have great power, you may have great endurance, but your ability to do fast contractions, which is what we need for laughing, sneezing, coughing, jumping, that may be the deficit. And so, again, instead of doing 3 sets of 10 or doing a contraction and holding them, I may prescribe quicker contractions over different intervals of time, if that makes sense.
Gotcha. Yeah,
So
so it's really personalized. So,
it is.
yeah.
And this is why I really there's a lot of great information on YouTube and online, for example, but I do really encourage people to get assessed by a pelvic floor physical therapist because that may not be what you need. Uh,
Yeah,
we wanna get it as specific as possible. Just like if you went to a physical therapist for a knee injury, they're not gonna say, "Oh, you have knee pain? Well, for knee pain, we only do these 5 things."
right.
You need to think of pelvic floor therapy in the same way. And so to your point about trying to get in sooner even before those 6 weeks, even though I'm not going to do an internal assessment until you've been cleared, there's a lot of the assessment that we can actually do externally to start to get you on that rehab plan that is best for you.
Yeah. I think that's just an interesting point that it is a one size fits all, just like so many other things, right?
Yeah. And, all that to be said, there certainly are people who can get away with following very generic instructions, but that is not the norm, I will say.
Yeah.
I've
Yeah.
certainly had many people who come in and say, "I don't understand, I'm still leaking or I'm still having pain. I'm doing Kegels like my doctor told me to do or like the internet told me to do." And we do the assessment and find out, actually, that's not what you need at all. You need something totally different, and maybe we'll come back to the Kegels at some point, but for right now, we need to start at a different place.
Yeah. That's like the problem with people Googling or trying to self-diagnose
Yeah.
sometimes. But I know it's also like kind of the first thing you think of sometimes, right? And it's so easily accessible. But so what are some reasons why moms would be having painful sex postpartum?
Yeah. So there's 4 main pathological or physiological reasons why you might be having pain with sex. The first one is hormones. So the vulva, the physical architecture of the vulva, the size, the shape of the labia, the pH of the skin around the vaginal opening and around the urethra, all of those structures really require a certain amount of estrogen and testosterone to maintain health and wellness there. And so you think about what happens during pregnancy. When you get into the second and third trimester, you have a massive surge of estrogen, massive. Once that baby is out of you and the placenta has been born, that estrogen has a significant drop off. If you could imagine a cliff, it's like that estrogen just falls off a cliff. And so, what that means for those structures of the vulva, the vestibule, which is the area of tissue around the vaginal opening, it's common to literally see changes to the genitalia and to the architecture, and skin integrity. When you are breastfeeding or pumping, that maintains that lower estrogen level. So, for example, if I were to do an exam and I separate the labia, I look at the tissue around the vaginal opening, a lot of times it will be really bright, hot red, almost like a rug burn. The texture might look a bit rough,
And
it,
this is just initially postpartum with
but can persist throughout the breastfeeding and
okay. So
pumping.
this is once your estrogen drops.
Correct. Yeah.
Okay.
So, if that is the case and that tissue, that skin is so sensitive and irritable, that in and of itself can be a reason for painful sex because imagine something tried trying to penetrate through that really rough, fragile, tender, thin skin, of course
Right.
it's gonna be painful. And so if that's the case, there is a place for pelvic floor physical therapy, but we may also need some additional medical services like a topical estrogen cream or like an over the counter salve like Vital V or Jolva, things like that, that help to repair and soothe that tissue.
Which
So,
is similar, which is very similar to postmenopausal women once their estrogen drops and everything gets dry. It's the same thing postpartum with the drop in estrogen. Okay.
yes. So people don't always like the way that I say this, but technically, when you're in that immediate postpartum period, you are in a physiologic state of menopause. It's not the same as menopause that lasts, once you turn 55, 60, and lasts until the day that you die, right? It's different, but there is a lot of similarities into what happens to your body. And I really wish that providers would educate people more about what to possibly expect in the postpartum period because it can be a lot to manage caring for
Well,
the new
in
child.
instead of just getting dropped off the cliff.
Exactly. Yeah.
Yeah.
And there are things that we can do to improve these conditions and make them better.
Yeah.
Well, hormones is a big, big, big factor. And a lot of times I have worked with people who say, "Well, why didn't my obstetrician tell me about this?" Or they did my 6-week exam and they didn't say that I had this condition. Well, unless your physician or midwife has gone to like a sexual medicine conference or gone through some additional training or maybe had a mentor that taught them how to do these exams, this exam of the vulva and vestibule is not actually a part of traditional obstetric and gynecological education. And so when they're doing their exam, they're using the speculum to look inside, but they bypass all of the external genitalia. It's pretty ridiculous because if you think of a man with a penis and he said, "Oh, I have penile pain," but the doctor only looks at like the testicle or perineum, right? It just doesn't make any sense. So there's a lot of structural things that we need to work on, but it's important for people to feel empowered and know that there can be like a dermatological reason for your symptoms and getting the appropriate treatment is really important because no amount of pelvic floor physical therapy that I do is going to change that skin integrity in that tissue.
Right. And ultimately, you need some kind of lubrication because the estrogen's just drying it all up right there. So,
And
I never put together that the hormones itself can be one of the reasons to cause
yeah,
painful intercourse postpartum.
typically what the symptom would be pain with initial penetration. Like that first, inch or so feels like a burning, raw, painful, maybe even a tearing sensation. But once the penis is deeper inside, the inside part may feel okay. But it's just that initial penetrative action that's like, whoa,
Like a
really.
carpet burn or something.
Exactly.
Yeah.
So then the second reason why we see pain with intercourse postpartum is scar tissue. So we know that 90% people who have vaginal births will have some degree of tearing, which is pretty high. When you have, for example, a grade 2, 3, or 4 tear, which would be a tear through the muscle belly of the perineum, for a grade 2, 3 is to the external anal sphincter, and a 4 is through the sphincter and up into the mucosal membrane of the rectum. All 3 of those categories will always require some degree of stitching to repair that. That's not something that's gonna heal on its own. It really does need to be sewn back together. Just like anywhere else in the body, that stitching is gonna promote scar tissue formation, right? Which is good. We don't want an open wound, but sometimes that scar tissue forms too tightly. Some of that is your genetic predisposition. Some of that is how much activity you have. If you're a really sedentary person, that scar tissue may form a little bit more densely just because it's not getting enough blood flow and nutrition.
Yeah.
So again, you think about if we're talking about penis and vagina sex, that is going to cause some degree of stretching along the perineum. And if that scar tissue is pulled really taut, that may not feel really great and be a source of pain as well. People can also have tearing into the labia. I've even seen a tear up into the clitoris. So, again, any scar tissue along the vulva into the perineum or down into the anus can be a source of pain as well.
Yeah.
People who have those kinds of tears and scar tissue are great candidates for pelvic floor PT. We see a lot of really great results when we can improve the mobility of the scar tissue, because what we're ultimately doing is improving blood flow and nutrition to the area to promote healing.
And what does that look like? Sometimes that's external examination and massage and really working on that scar tissue, right?
Correct. So that can involve a lot of massage, manual stretching. So, me as the physical therapist manipulating that tissue. It can be some myofascial work of the surrounding structures. Sometimes it means me teaching you how to do it at home and then instructing you to do it at a certain frequency. There can be some variability. But then at some point, we also have to think about okay, we have this scar tissue. What's the status of the muscle that the scar is running through? So if the scar tissue is taut and the perineum is taut, we may need to do some stretching to the muscle. So I may prescribe some stretches or some eccentric loading to that muscle to get the muscle to work better, which in turn is going to help the scar.
Yeah.
That makes
Interesting. Yeah. That's neat.
Yeah, and then moving into the third reason why I see people who have painful sex is certainly muscle tightness. So again, thinking all birth is technically a quote unquote trauma to the body. It does cause injury, whether it goes really well or really poorly. Um, it's completely normal for those muscles to react and tighten up to get away from the painful stimulus. And so, if we've got tight pelvic floor muscles deep inside the vaginal cavity, that can also be a source of pain as well. So, imagine you've got a really tight bicep, and I'm trying to, move my hand through. There may be not only pain, but it may present as a symptom like it feels like he just can't get in, like there's a wall or it gets stuck. That almost always is tight pelvic floor muscles. And again, depending on where the tight pelvic floor muscles are, sometimes it's one side, sometimes it's both sides, right? That's going to dictate what I, as a physical therapist, prescribe to you. In some cases, it may mean the use of what we call vaginal dilators, which is a progression in size of dilation that helps to improve tolerance to stretch in the vaginal cavity or the vaginal canal. Or it may mean prescription of what we call a Theralond or a pelvic bond, which if you're watching the recording of this, it's like a big S shape, and it's a way to basically do self internal trigger point release at home. So sometimes I'm teaching people how to use that. Sometimes I'm using my own clean gloved hands to do internal trigger point release to those muscles. And then progressing again people through a period of appropriate exercise to improve the range of motion, the mobility of those muscular structures.
Okay.
And then the fourth and final reason, there are some other reasons, but I would say these are the main ones, would be nerve. So if you've had a forceps assisted birth, those will always result in a greater degree of tearing through the perineum and often into the anus and rectum. When you're tearing through those structures, it's also possible that you tear or disrupt the pudendal nerve, which is the main nerve of the pelvic floor. What makes that nerve unique is that it has autonomic, meaning automatic functioning. It has motor function, which is that contract and relax function, and it has sensory function. So it's that we know of the only nerve in the body that really has all three, which makes it really interesting and cool and unique, but also kind of a design flaw Because when we disrupt that nerve, that means that we can have issues with automatic functioning, with muscle coordination, and with pain. And so, for these people who have some sort of nerve disruption, either from a forceps birth or prolonged pushing where that nerve just gets so overstretched, or maybe they had an avulsion tear to one of their pelvic floor muscles, these are people who not only have painful intercourse, but also will have painful sitting, or when they touch it, it may feel like around the sit bone or along the perineum, it may feel raw, burning, stabbing, shooting, those kinds of sensations. And so in those cases, it almost all always get, at least somewhat better, but most of the way there, but may involve a lot greater a variety of treatments because now we have to think about a lot of different structures.
Now, with the nerve damage like that, would this person also possibly have, like, leakage and incontinent issues as well?
Yes, it depends on which portion of the fibers were disrupted.
Okay. Wow. So, with my 2nd child, I had a VBAC. I think I told you this previously, and I pushed with her for about 42 hours.
Woos.
By choice, I really, really, really wanted to have a VBAC, okay, and I did, but and I think I told you too, she was occiput posterior, which we found out right there at the end, but I did not have nerve damage, thank goodness, because everything you're saying with that, I'm like, "Oh my goodness, wow." So,
It's certainly not the most common presentation for painful intercourse. This I don't know the exact, population percentages that this happens to. It's certainly not as high as you would think, but it is something to consider and something that is always in the back of my mind when I'm evaluating people, especially if somebody's not getting better. Or again, maybe they have this cluster of symptoms like I'm also having pain with sitting. I'm also having pain when I bend over to pick up my kid or do squats, things like that. Uh,
yeah.
and again, depending on the fibers that are involved and which branch of the nerve is involved, sometimes it means that people will have clitoral pain or anal burning or itching pain as well. And so those people are for sure the people that need to be advocating for themselves to get into a really highly qualified pelvic floor physical therapist who specializes in the pain syndromes because these cases are a little bit more complicated and they require somebody with a higher level of skill.
Yeah. That's That's so interesting. I don't think that, you know, postpartum painful sex is not talked about enough, and there's already too many other things going on postpartum. So, if you can easily go to somebody like a pelvic floor therapist postpartum, if you're having issues like this, that's just one more person to be there to help you. So that's awesome.
Exactly. So yeah, those are the 4 main reasons why somebody can have pain with sex.
Yeah.
Other thing that I always tell people too is sex is complicated. There's so much that goes into making it work, right? Attraction to your partner. If your partner is not showing up for you postpartum, doing the laundry, taking care of the kid, that's not sexy and attractive, right? People
Yes.
often forget that it takes 2 to tango, and if your partner is not showing up for you, many women are not gonna find that attractive, and so in as a consequence, you're not gonna be turned on, right?
Right.
So, whatever ability you have to naturally lubricate yourself is gonna be diminished and therefore cause a drier vagina, the pelvic floor muscles aren't gonna relax, and it's not gonna be fun, right?
Yeah.
So that's definitely a big reason that people don't talk about enough, but should be at the top of the list. And then second to that, or depending on who you are, maybe even first above that is fatigue, right? When you're
Yeah.
woken up every hour, every 2 hours, depending on how your baby is feeding, right, or sleeping, that's really going to suppress, again, a lot of these hormonal functions that are necessary to create homeostasis in the vulvovaginal region. And so we can have, perfect skin down there, no scar tissue, perfect muscles, perfect nerve function. But if we don't have a great relationship with our partner, or great communication with our partner, if we don't have great sleep, proper nutrition, and hydration, those are also reasons why sex can be painful or uncomfortable or make it feel like, wow, I used to experience pleasure a lot before or orgasm really easily before, but now I can't. Sometimes we have to look into those problems too.
Yeah. And some of those you can control. Like, you can
Right.
make sure you're being hydrated and doing the best you can to get your sleep, and it's
Yep.
so hard postpartum, but, some of this you do have control over, so that's
Yeah.
awesome.
And I think kind of to that point, something I really try to emphasize, especially to my pregnant clients as a way to prepare for postpartum is if you look at history and then you also look at now the latest research, we are not supposed to be doing this alone. Not at all. Right? This idea that we can be superwoman or supermom and literally do it all is actually not how we're biologically wired. We
Right.
biologically wired to give birth in the company of others, with our friends, with our family, with our children, with our doulas, our midwives, our OBs. And the same thing for postpartum. We're not meant to be in this period where we're alone and isolated and responsible for 100% of the work. And so if you don't have a partner or a husband or somebody who can show up for you in the ways that you know you're going to need, start building your village and your community before it becomes an emergency where you're, on the brink of mental collapse, right? Start thinking about who can I reliably call upon to bring me meals, to make sure that I'm getting to my appointments, to taking a night shift every once in a while so I can sleep and somebody else can bottle feed the baby, right? Start thinking about how you're gonna work through that because not only is that gonna impact sex, right, but also just your overall physiological state of well-being and healing.
Yeah. It takes a village, it really does.
It really does, and I think people underestimate that, especially in the United States, where we're very nuclear family focused. We're relatively isolated from extended family compared to the rest of the world. We need to come up with some ways to substitute and change that because it isn't how we are biologically wired to work.
Yeah. Yeah, I love that you pointed that out. I do wanna go back to something too. You were saying some patients will come to you and they may have been having painful sex for years postpartum, and maybe they're just now realizing like, "Hey, this is not normal," and it's been, 5 or 6 years. People that come to you, I say that late in the game postpartum, what is the success rate of them being able to enjoy sex again and it not be painful?
Oftentimes 100%. It,
Yeah.
of course, depends on what the root cause of the pain is. And sometimes what we see with people who, for a myriad of reasons, that pain persists for a long period of time, their body becomes almost sensitized, right? Because that signal from the pain site to the brain, that button has been hit so many times that you actually see changes to the brain. It's not impossible to undo those changes in the brain because of a process called neuroplasticity, but it may sometimes take a little bit longer, or maybe we have to be a little bit creative about how we approach it. But again, for the most part, we're talking like a really high success rate of reducing these symptoms. Yeah.
Yeah, that's great. I'm glad that you pointed out the neuroplasticity aspect of it because I do talk about that a lot and just how we are not our genetic makeup. We are not, our circumstances. We can alter these and change them. And even in this situation, so
Mhm.
I would think that there are probably some people out there listening that think, oh, wow, well, I'm too far postpartum. This won't apply to me, but it could very well. It
Yeah.
can.
Oh gosh, I've seen people who are now in menopause, have had painful sex since they had their children, 30 years ago, and are just now coming to me to get it addressed. Not impossible, certainly a little bit more challenging, but it is never too late. And I always say to people, if it is something that you want to address, It is your right to have providers refer you to people who can offer treatment for what you need. And sex is like totally reason enough to get treatment. I'll add a little note to this. So Medicare, for example, dictates a lot of how insurance covers these services. As recent as a couple of years ago, Medicare did not recognize sex as an activity of daily living. It's a basic biological function. And so, what that means is that if a physical therapist was plugging in a diagnostic code for dyspareunia, which is the medical diagnosis for painful sex, it would not be reimbursed.
Wow.
So we've had to kind of be creative sometimes about how we code for these things because we still have these larger systemic structures that also buy into a lot of the social and cultural taboos that we have in the United States about sex. So, all that to say, sex is a biological function. It is something that's meant to be pleasurable, it's not meant to be painful. There's a whole medical specialty called sexual medicine that is researching and treating people with these conditions, and pelvic floor PT is a part of that model of care.
Yeah. That's awesome. It's awesome to know that there is a specialty devoted to that and that, women have a safe place to go for things
Exactly,
like that. So,
exactly.
I mean, gosh. I
Yeah,
feel like I really honestly, I just think this stuff is so cool. I could talk about it forever. But as far as postpartum painful sex, I feel like we covered a lot of different reasons why this could be happening. Is there anything else that you feel like is really important for mamas postpartum to know or keep in mind?
yeah, we talked about people maybe waiting too long to report these symptoms and get treatment. What I also wanna kind of plant the seed for is that just because your doctor has cleared you at 6 weeks, maybe doesn't mean that you're ready, and it's okay not to be ready right at 6 weeks. What that clearance means is that you're no longer an infection risk. Your
Yeah.
wound is closed, you're not actively bleeding, you're not at risk for an infection, so go have fun. Well, that really isn't the entire criteria that we should be screening for readiness to return to
Because that
let
does not
alone
mean that your pelvic floor is ready
correct,
necessarily. Yeah.
correct. And so I really want to emphasize that if you don't feel ready, don't do it. Do not succumb to the pressures of your husband, of your partner, or of yourself to say, "Oh, well, I feel bad for my husband that he just can't have sex right now." Okay, that's his problem, that is not your problem, okay?
Right.
If your body isn't it takes 2 to tango. If your body isn't ready, it is not ready, and that is okay. I see consequences, yes, of people waiting too long to get treatment, but also of people trying things before they're ready. Again, I use this example of if what happened to your pelvic floor during birth happened to your quad, running a marathon, you'd have trouble walking upstairs, you'd have trouble walking long distances, right? So we need to treat the pelvic floor the same way we think about a leg. And that means, yes, getting into pelvic floor therapy as soon as you feel comfortable, but it also means not pressuring yourself to get back to activities too soon. Because what can happen is if you have sex that is a painful experience and you try to push through, we can develop a trauma response where now we have this psychological trauma of being painfully penetrated once, twice, 3 times, however many times, and now we go to pelvic floor physical therapy, our pelvic floor is better, but I'm still having this aversion to sex because now I'm traumatized, right?
Yeah.
So, we need to consider that too, and I just really wanna emphasize to people that don't return before you really feel ready and emotionally connected to the person that you're having sex with.
Yeah, I think that's a great point. I would like to add too that just normalizing your pelvic floor muscles as another muscle in your body and treating it the exact same way as any other muscle.
Right.
We just don't think about it like that for some reason. And even me, like, I'm pretty familiar with pelvic floor therapy, and I did have pelvic floor therapy postpartum with 2 of my children, but my brain still isn't trained to go there automatically, right? Like, just we've been in a society that doesn't normalize that. But it
Right.
makes complete sense, especially whenever you compared it to birth is just the equivalent of running 2 marathons, and you think about your pelvic floor stretching, like you said, so much during a vaginal birth, especially. And I mean, why would you expect to not do some kind of physical therapy afterward?
Right.
It
It's
doesn't make sense. It's so, it just, yeah, it's just interesting to just kind of sit and think about, but just normalizing that these are just like any other muscle in the body. And if anything, I think for women especially, they're so much more important than so many other muscles, but we don't treat it like that, which is so weird. I know I've seen so many women postmenopausal that have leakage or have dryness, all kinds of factors that are all affected by the quality of their pelvic floor that are controllable to an extent, right? But they don't know what to do about it. They just go to a doctor about it, but they don't actually think about, okay, what's the root cause of what's happening? And really finding the root cause of that is just so important to me.
yeah, so, so important, right?
Yeah.
I in thinking about what you said and, women historically have really, really been disempowered by this medical system in a lot of different ways.
Yeah.
There are a lot of us who are rapidly trying to change that on a larger scale. And I say all that because I've heard people say, "Well, if you know about pelvic floor PT, why don't you just go?" I don't understand why people aren't taking this into their own hands. And what you have to understand is when you have an entire group of people, 51, 52% of the population, who has historically not been heard, has been gaslit, has been ignored, literally hasn't been researched until the year 19, right? How can we expect that women and people like us even know that what we're experiencing is a problem? I mean, think
Right.
about your mother and your grandparent who said, "Oh, yeah, you're peeing your pants after having your baby." Well, welcome to motherhood, right?
Exactly.
No, no, no. This has been normalized. Incontinence is common, but it's not normal. How have we gotten to a place where we've normalized peeing your pants?
Exactly. Exactly. It
Ridiculous, right?
it blows my mind. And I yes.
Um,
Uh
it's the same with sex, right? We have normalized pain for pain is not a normal experience, especially for sex, which is designed to be pleasurable. It's not supposed to just be pleasurable for the man. It's supposed to be pleasurable for you too. And so I think again, when we kind of zoom out and think about these larger structures, yes, there's a lot of components that we have to change, but we also have to really change the way that we talk about it with our friends, with our mothers, with our grandmothers, with our daughters, right? So that we can bring up a generation that expects better and
yeah.
hopefully will get better.
Yeah. I think that that is a awesome way to end the episode, Molly. Thank you so much for your insight today. This just has been super helpful.
Great. I'm so happy to be here and thank you so much for having me.
Thank you for being a part of my journey on What the Gut podcast. For a deeper dive into today's topics, head over to allisonandwellness.com/whatthegut or find the detailed show notes linked below. Hey, and don't miss out on future episodes. Hit that subscribe button, and if you love this one, please leave me a review. Let's keep the conversation going over on Instagram. Connect with me and stay updated and engaged with my awesome community. Plus, share these valuable insights with your tribe. They deserve to feel as amazing as you do. You can find me at Allison_and_wellness on Instagram. Your support means the world to me. I'm looking forward to our next awesome chat. But until then, stay curious, don't drink too much coffee, keep the vibrant energy flowing, and take care of your gut. Catch you real soon. Oh, and hey, if you're ready to dive deeper into personalized wellness, check out my one-on-one health coaching program at allisonandwellness.com. Let's make your journey to holistic health truly transformative.